Okay, so here is our talk about obstructive versus restrictive lung diseases and how these types of diseases would affect all these volumes and capacities that we just learned about. So let's start with our obstructive diseases, all right? And what I want you to notice is obstructive results in, all right, more air trapped in the lungs. So think about it. What are some diseases, respiratory diseases that you know of that would cause air to be trapped in the lungs, right? Meaning that you can't quite get more air in and you can't get air out. So it makes exhaling difficult, all right? But it also would make inhaling difficult as well because the lung is already inflated to its pretty much its max. So there's not really more air that can fit in. So I'm guessing you guys are saying things such as like asthma, bronchitis, emphysema. These would all be good examples of obstructive lung diseases. Okay, so for example, in asthma, all right, we see in the bronchial tubes, all right, the bronchioles, the bronchi, all right, we see narrowing of those tubes. So if we narrow the diameter, we make it smaller, now we have more resistance, more pressure, all right, to airflow. So it's resisting airflow in, all right? And so if it's resisting airflow in, it's also resisting airflow out, and thus all this air is getting trapped inside the lung, okay? So what you can clearly see here, all right, is this should be what the tidal volume would be compared to a normal lung. And so the tidal volume is clearly getting bigger because, again, think about it. If you have an obstructive disease and you have more resistance to airflow, then your normal breathing is going to be labored. It's going to take you more effort and more force to just take normal breaths. Thus, all right, you look up here and you notice that our IRV is decreased. Well, why is that? Well, compared to here, like look, all right? So think about it. Well, if your tidal volume increased, it now took up this much space from here to there, right? Of what should be your IRV. So because your tidal volume increased, your IRV had to decrease, okay? Because there's no more space, all right, as a result, all right? Now, if we look at your ERV, okay, here's your ERV, all right? I should just do it the other way. This would be your ERV compared, so this much of a difference, essentially. Okay, so this is also decreased. And why is that decreased? Well, again, we'll have to look at the big entire lung and try and figure that out. It doesn't have anything to do with your tidal volume, right? Because your tidal volume, the base of it is the same, okay? So your tidal volume affected your IRV, okay? But what's happening is here is what else did increase. And you can see from here to here, your residual volume, all right? And so that means that your ERV decreased because your residual volume increased, meaning that we can't get, if we have air trapped in the lungs, that means when we forcefully exhale, we can't get as much air out, okay? So as a result, that air has to be somewhere. Well, where is it? It's trapped right at the base of the lung here. And so why is the lung so much bigger? Because we get so much more air trapped. Look, so much more air trapped inside the lung that can't get out. Okay, so hopefully this makes some sense, and I'll kind of do it one more time after we go through some of these pictures here. notes here. All right. So in obstructive diseases, we see an increase in resistance. So again, that can be a narrowing of the bronchial tubes, like in asthma and bronchitis. All right. It can be scar tissue as a result of something like emphysema, right? That all increase resistance of airflow. So we have a difficult time exhaling air from the lungs. All right. And an abnormal amount gets trapped inside. Okay. So damage to alveoli, that would be, and that example would be emphysema. Okay, and then this asthma and bronchitis. All right. So let's look at it one more time. All right. The big difference we see here is all this air trapped in the lungs. All right. And then here we say, due to this greater resistance in airflow, your normal breathing is labored. So thus your tidal volume must increase. Your normal breaths, all right, require more force. Thus you're having to force more air in. Okay. So those are the two main things. All right. Last thing, well, why does TLC increase? TLC will increase because, look, your total amount of air that you can fit in your lungs is obviously much bigger. But in this instance, is that a good thing? No, not a good thing. Okay. A lot of people wonder, well, why does vital capacity decrease? Well, remember, vital capacity is going to be TV plus IRV plus ERV. All right, and so as a result of these two decreasing, when you do the math, your vital capacity also decreases. All right, so now let's look at restrictive diseases. Restrictive means that the lungs, sorry, this is messy. It's really hard to write with this pen. Can't expand. They are restricted by something. All right, and so you're going to notice that all these volumes go down. And that makes sense because if air can't get in, okay, the lungs can't expand. All right. So restrictive diseases are almost like as if someone gave you a big bear hug and squeezed you really tight. Could you take a deep breath in? So any disease that causes that type of feeling, all right, is going to be considered a restrictive disease. So let's look at restrictive diseases. Okay, we talked about lung compliance is the ability to, or for the lungs to expand. Let's make that cleaner. All right, and so if the lungs can't fully fill with air, they don't expand, right? There's lots of different causes. So one, stiffness in the lungs themselves. That could be a result of scar tissue, could be fibrosis, right? Stiffness in the chest wall could be scarring, right? Lots of different reasons there. There could be swelling inside the chest wall, pulmonary edema, all right? And that could cause pressure on the outside of the lungs, and your ability to take breaths would be disabled. All right, weak muscles, so your intercostal muscles, diaphragm, etc. Damaged nerves, so the nerves that innervate those muscles could be damaged, or specifically the nerve that innervates the diaphragm, and then that is obviously very, very serious. So pneumonia, pulmonary fibrosis, pulmonary edema are all examples. All right, so pneumonia would be, all right, we get inside the lungs, you have a bunch of pus or mucus in your alveoli. All right, and then pulmonary fibrosis. Fibrosis is scarring. Okay. So in any of those instances, right, whether it's pneumonia, pulmonary fibrosis, pulmonary edema, all right, the lungs are not able to expand, all right, when you take a breath in, so when you inhale. All right, another example could be if you were tackled and you broke a rib. Now, again, that pain due to the fracture would not allow you to take deep breaths in. So that would be another example of restrictive. All right, I think that's it. Questions, please post on Google Classroom. All right, and we will go from there.